Okay, so you have a positive pregnancy test, your first one. Bet you're excited and scared. Well, I'm a board certified OBGYN physician, here to give you some general guidance to get you going and to answer some of your preliminary questions. First and foremost, we want you to start making arrangements to see your physician. And before you get to see that physician, you do have to review your medicines that you're taking and some of the foods and drinks that you're having, but that you need to modify once you're pregnant. There are separate videos on medications in pregnancy. There are separate videos on foods in pregnancy, but to start with, we want you to start taking some prenatal vitamins. Any over-the-counter prenatal vitamin is fine to start out with. You want to be careful about caffeine. We do know that 5 servings of caffeine a day is linked to miscarriage, and there is no known absolute safe amount, but you might end up with some headaches if you drastically reduce. So we'd like you to get down to at least no more than 1 or 2 servings a day. Now, a serving of caffeine is an 8-ounce cup of coffee, not at your local Starbucks giant, okay? Also, be careful about caffeine and sodas. I've had patients drinking 2-liter bottles of Pepsi a day. That's something that you've got to cut down. Also, you want to review the medicines that you're on. Some medicines are fine to take during a pregnancy. Others are of concern. For example, Synthroid is a medicine for hypothyroidism, and that's important to continue. Other medicines, like some certain antibiotics, can be a problem in early pregnancy. So when in doubt, try to stay away from it until you get some advice from your physician, unless it's essential for your health, and then you need to get that information very quickly, especially early on in pregnancy. The organs of the baby are developing, and one of the most vulnerable times for the development of the baby is from 6 to 12 weeks pregnant, and sometimes that's before you get to the doctor. So you need to get a handle on what's appropriate for you as far as stopping, reducing, or eliminating some of your medicines as soon as possible. It is not uncommon to have some nausea, difficulty holding things down. There's a separate video that we'll be providing on nausea, vomiting, and pregnancy, but to start out with, you might try some Benadryl, the allergy medicine, to help with the nausea. You might try Unisom, which is doxylamine, a sleeping pill. Make sure you try to drink lots of fluids. If you're not able to keep things down and you're not going urinating often, getting dehydrated, that can be of concern, and you need to be seen to get that addressed. Look at the other video that I have provided with more details on that information. So once you've arranged your visit with your physician, when you get there, they may or may not do an initial ultrasound depending on your potential history. It's pretty common for physicians to plan on an ultrasound around 8, 9, 10, 11 weeks pregnant to get a good, accurate assessment of how far along your pregnancy is. You'll get a physical exam and make sure that you're healthy and there aren't any issues that would interfere with the pregnancy, and screen you for infection that might interfere with the pregnancy. And then they'll address your particular case and the questions that you have. And again, the purpose of some of these videos is to give you a general idea of what's going on, answer some of the general questions, so that when you're in your own physician, you can hone in on what's particular to you. They'll offer you some blood tests, and you can see another video that we're providing with more details on the prenatal screening tests. And they will give you an outline of what's going to happen for your prenatal care, which generally speaking is a visit every 4 weeks in the beginning, taper it to every 2 weeks, and then the last month it'll be once a week. It's pretty common now for us to offer inductions or putting you into labor in the last week of pregnancy, from 39 to 40 weeks. That doesn't mean that it's appropriate for everyone. It doesn't mean that it'll be recommended for you. And in fact, that answer might not be available until you get further on in pregnancy. However, as a general rule of thumb, as of 2022, it appears that there is some benefit to reduce the risk of cesarean section by offering to be induced under the right circumstances. Just to give you an idea, if you're using those calculators and you're looking at when you're due, generally that's 40 weeks, and so we're talking in that week before. So hopefully you'll find this information of use. It's really also an introduction to some of the other videos that we have, which you can see before you see your obstetrician or family physician or whomever will be caring for your pregnancy, so you can get a head start before you go to that office visit. I hope you found this helpful, and we encourage you to give us feedback so we can help you out better. Thank you.